مرحبا جميعا، أنا دكتور محمود الأحمد، معيد في كلية الطب ومدرب لغات إسبانية في المعهد البريطاني للغات، وأيضا مؤلف كتاب رحلة في إسبانيا ورئيس سابق للاتحاد الدولي لطلبة الطب فرع لجنة باب المحلية. خلينا نروح اليوم بفيديو جديد، يلا. Hello everyone. Our video today composed from three parts. The first part is external nose, the second part is the nasal cavity, and the third part are paranasal sinuses. For the first part, the external nose composed mainly from two parts, bone and cartilage. The bones of the external nose are those. This is the nasal process of the frontal bone. This is the nasal process of the frontal bone, while this is the nasal bone. On the lateral aspect of the external nose, we have the frontal process of maxilla. Okay, let's repeat it. This is the nasal bone. This is the nasal process of the frontal bone, while on the lateral aspect of the external nose, we have the frontal process of maxilla. For the second part of the external nose is the cartilage. The cartilage of the external nose, this part of the cartilage which is called a lateral process of the septal cartilage, while this part, this is the boundaries of this part which is called major alar cartilage. This is the major alar cartilage, while this the small cartilage called minor alar cartilage. Let's repeat the cartilage. This is the lateral process of the septal cartilage, while this is the major alar cartilage, and this the minor alar cartilage. If you ask it what is this nerve called, this one called supraorbital, this one supratrochlear and infratrochlear. Supratrochlear, infratrochlear, supraorbital. All these are branches from the ophthalmic nerve, which is originated from fifth cranial nerve, trigeminal nerve, while this one, which is called infraorbital nerve, it's a branch of maxillary nerve, also come from trigeminal nerve. Okay, now for the second part of our video, which is the nasal cavity. As the oral cavity, the nasal cavity also have roof and the floor and medial and lateral walls. The roof of the nasal cavity, as you see this is the roof of the nasal cavity, composed from three parts. The anterior part composed from two bones. This is the nasal bone and this is the frontal bone, while the middle part composed from cribriform plate of the ethmoid bone, which transmits the olfactory nerve via olfactory bulb. The posterior part, which is called the sphenoid body. Okay, let's repeat it. The anterior part of the roof of the nasal cavity, which composed from the two bones. This is the nasal bone and this is the frontal bone. Middle part, which is composed from cribriform plate of the ethmoid bone, and the posterior part is sphenoid body. Regarding to the floor of the nasal cavity, which is the same as a roof of the oral cavity, the floor of the nasal cavity composed from hard plate, which is consist of two bones. This is the palatine process of the maxilla, while this is the horizontal plate of palatine bone. Now we complete the roof and the floor of the nasal cavity. Let's go to discuss the walls of the nasal cavity. For the medial wall, which is a very important wall, and as you see, this is the medial wall of the nasal cavity, also called the nasal septum. The medial wall of the nasal cavity composed from three components or four. This is the perpendicular plate of the ethmoid, while this is the septal cartilage, and this is the vomer bone. And there is many resources say that there is a nasal crest of the maxilla or palatine bone. Okay, let's repeat it. The medial wall of the nasal cavity or the nasal septum composed from three parts. This part, which is called septal cartilage, perpendicular plate of the ethmoid bone, and this is the vomer bone. Okay, for the lateral wall of the nasal cavity, which is the most complex wall in the nose, we have two important structures. As you see, this projection, this and this and this, which is called superior nasal concave or superior nasal turbinate, middle nasal turbinate or concave, and inferior nasal turbinate. Between this projection, there is a groove which is called nasal meatus. Here we have superior nasal meatus, middle nasal meatus, and inferior nasal meatus. What is the anatomical importance of these meatus? Firstly, to increase the surface area to warming the eye, and the second one is the opening of the paranasal sinuses during this meatus, also opening of the nasolacrimal duct. I would like to mention that the nasolacrimal duct are opened in the inferior meatus. If we're gonna to discuss the nerve supply of the nose, which is come from three sources. Firstly, the general sensation of the nasal cavity come from the maxillary and ophthalmic, which is branches of trigeminal nerve, the cranial nerve. While the special sensation, which is called olfaction of or smell, which is come from the olfactory nerve via olfactory pulp or tract. We have a mucus gland in the nose, which is received parasympathetic supply from facial nerve. Okay, this is the nerve supply of the nose. But if we wanted to discuss the blood supply of the nose, which is coming from also three sources, the first one is the maxillary artery. The maxillary artery will give two branches to the nose. This branch, which is called sphenopalatine artery, which is enter the nose through sphenopalatine foramen, while this one, which is called the greater palatine artery, which is enter the nose through greater palatine foramen. Let's to repeat it. From the maxillary artery, we have two branches, sphenopalatine artery and the greater palatine artery. From the facial artery, we have also two branches that supply the nose. As you see, this is the facial artery, which is gives superior labial artery, also supply the nose, and this is the lateral nasal artery. The third part of blood supply of the nose, which is the ethmoidal artery. Here we have the anterior ethmoid artery. This all thing regarding to the blood supply of the nose. For the venous drainage of the nasal cavity are in the facial vein and the pterygoid venous plexus in the infratemporal fossa. Now we would like to discuss the paranasal sinuses. We have four sinus. As you see, this one, which is called the maxillary sinus, which is the largest sinus in the head, and here we have this one, which is called the frontal sinus, and this is the sphenoidal sinus, and unfortunately we don't have anatomy module for ethmoid sinus. What is the function of this sinus? This sinus have function to decrease the weight of the skull and the amplification of the voice. As you see, this is the sphenoidal sinus, which is opening here in this part, which is called the sphenoethmoidal recess. Sphenoethmoidal recess. This is the sphenoidal sinus, which is opening in the sphenoethmoidal recess. Okay. For another sinuses here we have the frontal sinus, and here we have the maxillary sinus. Both these sinus are opening in the same meatus, which is middle meatus. Lastly, we have the ethmoid sinus. The ethmoid sinus, which is divided in three groups: anterior and middle and posterior. The posterior group are opening in the superior meatus, while the anterior and middle group are opening in the middle meatus. As I mentioned, the nasolacrimal duct are open in the inferior meatus. I hope you have a nice day. Goodbye. Adios. Hasta luego.